How does a 15-year-old walk into a hospital pregnant? And nobody stops to ask the question that should have come first. Who was she? What had happened to her? And how did a child end up in that situation, without someone looking beyond the medical chart and asking what was really going on? Those questions become even more disturbing when you realize this wasn't necessarily a one-time encounter. There were opportunities to see her situation up close. There were professionals whose job was to recognize when something didn't look right. So why wasn't the bigger question asked? How did a 15-year-old become pregnant in the first place? And if someone had asked that question back then, could it have changed what happened next? Tonight, we're going back to the beginning of the Siders case and examining the hospital's role, what it could have seen, what it may have missed, and the critical question that appears to have disappeared into the paperwork. Because when a 15-year-old arrives pregnant, the story shouldn't end with treating the pregnancy. Someone has to ask why. And in the Siders case, that may be the question nobody can answer for us. There's a question that should have stopped this. When Elizabeth Russell walked into a hospital in southeastern Ohio at 15 years old, about to give birth to her first child, someone in that building was legally required to ask if she was safe. That's not a courtesy. It's Ohio law. Doctors, nurses, social workers, they're mandatory reporters. If anything about a young patient's situation suggests abuse or risk, they are required to flag it. Elizabeth was a child. Having a child. 2 months earlier, she'd married an adult man, which means she got pregnant when she was 14, maybe even 13. Every single detail about her situation should have triggered someone to ask that question. We don't know if they did. What we know is that it didn't lead anywhere, because over the next 17 years, Elizabeth Siders returned to hospitals 15 more times. 16 children. 16 opportunities for someone to ask if she was safe. 16 times the system had a chance to intervene. And 16 times, apparently, it didn't matter. If this story has you asking how something like this could happen for nearly 2 decades without anyone noticing, you're not alone. Hit the like button and subscribe to Reopened Crime Scenes, because we're going to walk through every documented failure that made this possible. To understand how the system failed Elizabeth Siders 16 separate times, we need to go back to where it started. March 2008, a courthouse in West Virginia. Elizabeth Russell was 14, possibly 15 years old. She was there to get married. In most states, that would have been legally impossible, but West Virginia at the time allowed judicial approval for minors to marry under certain circumstances. And Elizabeth had a circumstance. She was already pregnant. A judge looked at a pregnant 14-year-old and the adult man responsible and signed the marriage certificate. That signature made the marriage legal. But it didn't change what had happened before it. A 14-year-old getting pregnant isn't a marriage. It's evidence of a crime. And 2 months later, someone in a hospital was about to come face to face with that evidence. May 2008, Elizabeth Siders, now legally married, walked into a hospital in southeastern Ohio in labor. She was 15 years old. In that moment, she became exactly the kind of patient that mandatory reporting laws exist to protect. Here's what should have happened. During intake, a nurse or social worker should have documented her age, noted that she was a minor, and triggered a standard safety assessment. That assessment would include questions asked privately, away from whoever brought her in. Questions like, do you feel safe at home? Is anyone hurting you? How did you become pregnant? These aren't invasive questions. They're protective ones. And for a 15-year-old giving birth, they're legally required. Most hospitals also employ social workers specifically for situations like this. Their entire job is to notice when something about a patient's circumstances doesn't add up, and to ask questions in a way that's supportive rather than accusatory. Anjanette Levy, an investigative reporter covering this case for Law and Crime, raised this exact point. She asked whether anyone in that hospital looking at a patient who was legally still a child under Ohio law, paused and asked what circumstances had led her there. The mechanism existed. Ohio has mandatory reporting laws. Hospitals have social workers. The infrastructure to catch exactly this kind of situation has existed the entire time Elizabeth Siders was interacting with that state's medical system. The question is whether anyone actually used it. What we know is that Elizabeth went home with her baby, went home to the situation she'd been in, and 2 years later, she was pregnant again. What happened once became a pattern, and that pattern would continue for nearly 2 decades. 16 children born between 2008 and approximately 2025. That's an average of nearly 1 child per year, which means at minimum 16 separate hospital visits, 16 separate encounters with mandatory reporters, 16 separate opportunities for someone to notice that a woman who had her first child at 15 was returning again and again, pregnancy after pregnancy, with no indication that anyone had ever asked if she needed help. Each visit should have included standard obstetric screening for domestic violence, assessment of family planning, postpartum support evaluation. Each visit created an opportunity for someone to see the pattern. A patient whose reproductive history began at 14 or 15. Rapid, repeated pregnancies. A growing number of children. Any one of these details could have raised concern. All of them together should have triggered intervention. For over a decade, the Siders family existed in what would later be described as institutional invisible space. No school records, no Child Protective Services investigations. The only institution that had any regular contact with them was the healthcare system, and we have no evidence that anyone in that system ever asked the right questions. But in the fall of 2021, something changed. For the first time, the Siders children came to the attention of a different kind of mandatory reporter. A school, October 19th, 2021. Gallia County, Ohio. A truancy complaint was filed against Gary Siders Jr. and Elizabeth Siders. The language is specific, and it matters. The child has been absent from school without legitimate excuse for the entire 2021 to 2022 academic year to present, an amount in excess of 72 hours, and is thereby a habitual truant. 72 hours. An entire academic year. And this wasn't the first contact. The document states that prior to the complaint being filed, the parents had already been notified in writing, warned about legal consequences, and given an opportunity to correct the situation. They didn't. There wasn't just one complaint. There were 6 separate truancy filings in the fall of 2021 alone, involving multiple Siders children. The oldest would have been around 13 years old. Ron O'Brien, a former Franklin County prosecutor who built a truancy intervention program during his career, explained why this matters. He said that when children are completely absent from school, not just chronically late but entirely missing from the system for an academic year, that's rare, and it's almost always a warning sign of something much larger. He pointed out that in serious criminal cases involving teenagers, their very first contact with the court system often wasn't the crime itself. It was a truancy charge years earlier, a warning that, if it had been caught and addressed, might have changed everything that followed. That's why Ohio takes truancy seriously enough to have legal processes around it. And in the Siders case, that process had finally begun. 6 complaints, written warnings, legal consequences outlined. For the first time since Elizabeth walked into a hospital at 15, an institution was asking real questions with the power to enforce accountability. The system was finally working. And then the Siders family vanished. January 7th, 2022. Just 3 months after those truancy complaints were filed, a new court document was entered. The court finds that Elizabeth Siders is unable to be served, and the whereabouts of Elizabeth Siders are unknown to the court. Therefore, it is hereby the order of the court that the above matter be terminated until the availability of Elizabeth Siders. Terminated, not paused, not escalated to another agency, not flagged for follow-up. Terminated. The system had finally noticed, had finally started asking questions, had finally begun intervention, and when it couldn't find the family, it just stopped. The case was closed, not because it was solved, but because the family had fallen through the gap one final time. For months, no one knew where they were. No one knew what was happening in that household. No one knew if those children were safe. But gaps don't stay hidden forever. And when this one was finally exposed, when investigators finally found the Siders family and saw what had been hidden for nearly 20 years, what they discovered was worse than anyone imagined. If you want to see part 2, where we cover what happened when the family was finally found and the accountability that followed, make sure you're subscribed to Reopened Crime Scenes. This story isn't over. The system failed Elizabeth Siders at least 16 separate times. We know that now. What we don't know is why. Was it bureaucratic gaps, legal loopholes? Or did one decision made in 2008 quietly disable every safeguard that should have protected her for the next 18 years? Because if a marriage certificate was enough to make an entire medical system look the other way, then this case isn't just about one family. It's about a vulnerability in the system itself. And right now, investigators are trying to figure out if anyone should be held responsible for exploiting it. Here's what I think is the actual mechanism. At the center of this entire case, if you zoom all the way out, it's not that any single institution, the school, the hospital, the state benefits office, completely failed to notice anything for 18 years. It's that each institution's authority stopped at a specific narrow boundary. And this family, whether by design or by circumstance, kept moving just past those boundaries before consequences could catch up. That difference matters. Because if it was by design, it suggests a pattern of deliberate evasion. And if it was by circumstance, it reveals something even more disturbing. That our systems are so fragmented, so siloed, that a family can fall through the gaps for nearly 2 decades without anyone connecting the dots. If this reframe is making you see the case differently, hit that like button and subscribe to Reopened Crime Scenes. We're going deeper into the systematic failures that made this possible, and you won't want to miss what comes next. Which brings me back to the hospital question, because I think it's the piece of this puzzle that's been examined the least, and it might actually be the piece with the most sustained opportunity for intervention. Here's why I say sustained. A truancy case is by its nature episodic. It depends on a school year starting, a child failing to show up, a truancy officer noticing, a complaint eventually being filed. That whole process can take months to even begin. A hospital visit is different. It's a single concentrated moment where a trained medical professional has direct physical sustained contact with a patient, sometimes over multiple days. If there were 16 individuals born into this family over roughly 17 years, that means at minimum 16 separate hospital admissions. 16 separate windows where medical staff had hands-on extended access to Elizabeth Siders and to the circumstances around her. And Jeanette Levy, an investigative reporter covering this case, raised a question I haven't seen anyone else articulate quite this directly. If Elizabeth was what she called a repeat visitor, meaning the pattern continued year after year at the same or similar facilities, was anyone connecting those dots? Was any single provider or any hospital system's records actually tracking the frequency and pattern of what was happening at an age that should have triggered exactly the kind of mandatory reporting conversation Ohio law requires? I want to be careful here, because I don't have confirmation of what specifically happened inside any hospital that treated Elizabeth Siders. I'm not accusing any specific doctor, nurse, or facility of anything. What I can tell you is what the law required and what the publicly known outcome was. Ohio law required medical professionals to report reasonable suspicion of abuse or neglect involving a minor, and the outcome based on everything that's publicly documented about this family's history, is that whatever happened inside those hospital visits, if anything happened at all, did not result in any intervention that changed the trajectory of what followed. But Levy also raised something that I think complicates this in an important way. And I want to include it because leaving it out would make this feel simpler than it actually is. By the time this pattern was underway, Elizabeth was already married, legally, under West Virginia law as it existed in 2008. Which means there's a real question about how hospital staff encountering a legally married patient would have processed her age relative to her marital status. Would someone that young who is legally married register in a hospital intake system the same way an unmarried minor would? Would that legal status have quietly closed off the kind of scrutiny that might otherwise have been triggered? I don't know the answer to that. I don't think anyone outside the specific medical systems involved knows the answer to that, but I think it's a genuinely important question. Because if legal marriage functioned as a kind of institutional shield, if it made hospital staff less likely to ask the critical questions simply because the patient technically had a husband and a marriage certificate, then the 2008 decision by a West Virginia judge to approve that marriage without deeper scrutiny didn't just enable one wedding. It may have quietly closed off years of subsequent opportunities for anyone in the medical system to intervene. That's speculation on my part, and I want to be honest that it is. But it's speculation built on a documented legal reality. Marital status does change how systems process people, and layered onto a documented pattern that apparently never triggered visible intervention, it raises a question that demands an answer. Did one signature in 2008 disable the entire medical safeguard system for 18 years? Let me bring this back to where the broader case actually stands right now, because I think it's easy to get lost in these individual threads and lose track of the larger legal picture. Prosecutor William Archer confirmed, before a gag order was put in place restricting further public statements, that Vinton County doesn't convene grand juries frequently. He described the timing as roughly once every month and a half. That's strikingly different from larger counties. In places like Franklin County or Cuyahoga County, grand juries convene essentially every single day because the volume of serious crime requires it. Vinton County operates on an annual budget of roughly $8 million. It's a small, resource-limited county government, and prosecuting a case of this scale, with 4 defendants, 16 individuals removed from a household, evidence spanning multiple counties and potentially multiple states, and now digital forensic extraction from electronic devices that investigators have confirmed they're working through, likely requires convening a special grand jury altogether, rather than waiting for the county's normal infrequent schedule. That digital evidence piece matters too. Investigators have confirmed they're in the process of downloading and analyzing devices as part of this case, a process that, even with trained analysts at Ohio's Bureau of Criminal Investigation working on it, takes real time to complete properly. Archer had indicated before the gag order limited further public comment that there might be updates within a couple of weeks. Whether that timeline holds, and whether additional charges emerge from what's found on those devices, remains publicly unknown as of now. All 4 defendants, Gary Siders Sr., Christina Siders, Gary Siders Jr., and Elizabeth Siders, have pleaded not guilty. They remain presumed innocent, unless and until a court determines otherwise. The grand jury has not yet convened. No indictment has been issued. I want to end with something that I think gets lost in a case this large with this many separate threads pulling in different directions. The marriage certificate, the truancy documents, the competency evaluations, the bond motions, the gag orders, and now this question about hospitals and mandatory reporting that may never be fully answered publicly. Elizabeth Siders, as a minor, entered a hospital system that would go on to interact with her repeatedly over the years that followed. And at every single one of those visits, Ohio law placed an obligation on the people in that room. Not a suggestion, an obligation to ask certain questions if anything looked wrong. We don't know if those questions were asked. We don't know what the answers were, if they were. What we do know is that whatever happened in those rooms didn't stop what continued to happen outside of them, for years, across multiple counties, until a warrant meant for something else entirely brought all of it into public view on June 30th. The truancy documents show us exactly what institutional failure looks like when we can actually see it written down. A warning issued, ignored, escalated, and then quietly closed because the family couldn't be found. The hospital question shows us something different, not a documented failure we can point to and read the exact language of. A silence where documentation should exist, and where, as of now, none has been made public. Those 16 individuals are in care now, receiving support. That process is ongoing, and it will take time the way recovery from something like this always does. But I keep thinking about that first hospital visit, and whatever question was or wasn't asked in that room set a pattern that, as far as the public record shows, was never interrupted for the better part of 2 decades. If you want to follow this case as the digital evidence review continues and the grand jury process moves forward, make sure you're subscribed to Reopened Crime Scenes. We'll be here for every verified development. Somewhere there's a chart, a record, a note from a visit that happened years ago that might tell us whether anyone ever asked the question that mattered most. We don't have it yet.